On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
I'm Peter Block, and with me is Deepak Bach, and we're wrapping up the AHA annual meeting in Dallas, Texas. So this has been a meeting that's had a lot of negative trials, but a few really nice high points, I think, Deepak. So let's talk first about the surgical side. Sort of unusual to see that at the AHA, but it's a good thing. Ischemic mitral regurgitation and its trial as to whether or not mitral valve replacement or mitral valve repair is the appropriate thing to do.
Yeah, overall, both strategies seemed equally good, which I think is an important message. There's been a lot of debate in the surgical community about, doing the repair instead of replacement. It's less invasive. Might there be some advantage to that approach? And that didn't appear to be the case. So I think that's an important lesson that in surgery, sometimes the gut instinct of the surgeon's not enough, and we really need to do proper trials.
We've been talking about this for a long time with our surgical colleagues, and particularly at Emory, they've always said, mitral valve replacement is not a bad thing. But the fact is, you take a little bit of hit, or patients take a little bit of hit at the front end because the risk is slightly higher.
Right, slightly higher risk of mortality.
As you go forward, you end up being about the same at 2 years.
Right.
And, it depends a little bit on how you want to play it, I think. But certainly the two are equivalent, and you can't say that mitral valve replacement is not the right thing to do at this point.
Absolutely. And if you want to really make sure there's no MR, hard to beat a mitral valve replacement.
Okay, so let's move to the other sort of interesting trial, peripheral vascular disease. Again, not directly in cardiology as such. The ARRACE
falls
trial.
under cardiovascular.
Yeah,
it counts.
It counts. So the ARRACE trial. Peripheral vascular disease, stenting versus exercise alone.
Right. And what the study found was that if we stent low extremity lesions, obstructive lesions, tight lesions, that improves walking distance and pain-free distance as opposed to just recommending exercise programs. So I think that's an important message because in general, I think peripheral artery disease is undertreated. Exercise programs, of course, are important, smoking cessation, et cetera. We always recommend that, and patients sometimes do it or sometimes don't. But this trial nicely shows that stenting added to that type of regimen improves patients' quality of life, and that's important. And, in terms of vascular stuff, I'm actually wearing my AHA walking pedometer, so this is telling me how much I've been walking around.
How much have you 20 feet. Not exactly.
Well, there are a lot of escalators.
That's right.
It's not my fault.
Okay, so let's move on to the trial that actually may change the way we take care of patients. And that's this atrial fibrillation trial, a new anticoagulant that actually works.
Absolutely. So in my opinion, this is the biggest trial coming out of the AHA in terms of the late breakers. It was conducted or led by my colleagues from Brigham and Women's Hospital. This was a trial of atrial fibrillation patients randomized to either warfarin or one of two doses of edoxaban, a novel anticoagulant, a factor Xa inhibitor.
So let me interrupt. We should call it Engage AF because that's the name of the trial, so
yes.
People know what it is.
Absolutely. Okay. And what it showed was non-inferiority for both doses of edoxaban versus warfarin, but even more exciting than that, significant reductions in bleeding and a reduction in intracranial hemorrhage that was both large and significant. Beyond that, there were reductions in cardiovascular mortality that were significant. So really a home run, in my opinion, not just for this particular drug, which is investigational not approved as of this time, but just for anticoagulation using the novel anticoagulants in atrial fibrillation.
So a drug that is not approved yet, hopefully will be soon. We've got the bands as big winners. And with that, maybe it's a good way to end this wrap-up. Thank you, Deepak, for Peter Block. And on the scene, we'll close with that.